Ontario. What about COVID-19 across the country? Today, Canada's Chief Medical Officer of Health warned against large holiday gatherings, saying we could see a resurgence of COVID-19 cases. But so far, the government has not changed its travel recommendations, with time ticking down before the holidays. So, how do Canadians make safe plans? Let's talk to three MPs. Rachel Bendayan is the Liberal MP for Outremont. Eric Duncan is the Conservative MP for Stormont Dundas South Glengarry. And Don Davis is the NDP's health critic. Welcome to the three of you. Happy Friday. Thanks for being there. Let me start with you, Rachel Bendayan. Health Minister Duclos was asked point blank today if Canada will change its travel guidance. Take a look at this.
We're not currently advising Canadians not to travel. That could come. And if it does come, it will have to come through a combination of different input, as I said, and different sorts of advice. But what we see now, what we hear now from public health officials in Canada and from the international context, is that people need to be very aware that traveling outside of Canada, as I said, comes with risk.
Risky and unstable, expect delays and hassles. Ms. Bendayan, then, how do Canadians make plans, or should people cancel their plans? I think that's the big question out there, is a bit the confusion, understandably because of this variant. But what should Canadians do? What is the government actually telling them?
Well, thank you so much for that question. And let me just first say how much I understand Canadians' concerns around what is happening right now. I think everybody is looking for straight answers, and the reality is we have a new variant of concern. Experts do not know a lot about this new variant, and so what the government has done at the federal level is to strengthen our testing, strengthen entry and quarantine requirements at the border, increase monitoring of new variants, and really reaching out to experts right across the country in order to better understand our current situation here in Canada, given the increasing numbers that we're seeing, particularly in Europe, but in different countries around the world. I mean, one of the things that we have first and foremost in mind at the federal level is, of course, to protect the health and safety of Canadians and to protect all of the sacrifices that Canadians have made over the course of the last 12 months. Listen, I live in a province, I live in Quebec, where we had a curfew for much of the pandemic. We have made extraordinary sacrifices in order to keep our numbers down, in order to protect our neighbors, and we certainly don't want to lose all of the gains that we've made over the course of the last year. So we've taken stronger measures, and we are continuing to monitor the situation very, very closely.
Yeah, and I understand that. I understand your answer, but Mr. Duncan, I want your response here, because does the federal government need to give Canadians clear recommendations for this holiday season? I mean, I think what the minister said was pretty clear: risky and unstable, expect delays and hassles. But there's still, no travel advisories. So, is it possible to be more clear?
Yes, Joyce, and I've been on the program several times talking about that. Last week I was here, I think it was last Friday, talking about the Canada-US border, the ArriveCAN chaos, and travelers having a lot of frustration with that. And here we go a week later again when it comes into holiday travel. A lot of people are planning to see family they haven't seen in the last couple of years. And I know even just in my constituency office and conversations amongst my own family the last couple of hours, I was literally getting some messages here on my phone in waiting for this interview about what are we going to do and what's changing. Well, what's the government direction? So, yes, I think there's an opportunity to be clear here. And I think the government needs to make sure we get the best medical advice of the current time. And Joyce, what I always keep saying is, too, there are some unknowns, and there are a lot of unknowns about this variant. But what we do know is that vaccinations, boosters are going to be effective in addressing this, getting children that are recommended for it, getting adults for their booster, people stepping forward from that. And you see that in the modeling today, that if we get more boosters out, we get younger people that qualify and are eligible to get vaccinated, we can beat back this latest curve in modeling and keep open and keep with our families this holiday season. It's going to be a challenge, but communication needs to be clear sooner rather than later on this.
Yeah, I mean, like we all have to admit that this is a little bit discouraging. Rachel Bendayan saying we in the province of Quebec have been locked down. Everybody has made sacrifices. Everybody's a little bit fed up, understandably. But Don Davis, today's federal modeling is warning against resurgence that could see Omicron cases skyrocket. So, how much responsibility can the federal government really take here, and how much of it goes to the province in dealing with this? Because it's sometimes very difficult to tell whose responsibility is this.
Well, that's a great question, Joyce. It's both, obviously, and we need all levels of government working together and developing clear, concise, and effective policies. You have the federal government, for instance, that controls the borders. And of course, Omicron is something that was discovered elsewhere on the planet. And so having effective border control measures and clear quarantine rules are critical on the federal government side. And of course, on the vaccination side, that generally falls to provinces. But, I want to just underscore that Canadians are understandably tired and frustrated. We're approaching 2 years of this worldwide pandemic. And so I think it's more important than ever that Canadians follow public health guidelines and guidance. And I think equally, the federal government has a responsibility to speak clearly and have properly administered rules. And, what I've seen in the past week and a half with the minister's announcements on the travel guidelines, which were very confusing, and then the AG report that came out yesterday that effectively gave a terrible, scathing report on Public Health Agency of Canada's lack of enforcement of the rules at the border, means that we've had anything but clarity and coherent enforcement of rules. So for us to get out of this, we need clarity, we need enforcement. And finally, I just want to take a moment to say the long-term answer to this, Joyce, is what we've been saying from the beginning. It's global vaccination. And experts warned about this, that we would get a variant of concern developing in a place that wasn't vaccinated, and yet the Liberal government is at the WTO opposing the efforts of countries like South Africa and India to be able to manufacture their own vaccines. And so I take no joy in saying that, but it's an opportunity for us today to say, look, we all have an interest in making sure the world is vaccinated, not just for equity reasons, but because it's needed to keep us all safe.
I want to quickly, talking about federal, provincial responsibility, who is the person that you can turn to? Which government can you turn to, rather? Rachel Bendayan, a new Twitter account called Test Finders, is helping Canadians find rapid tests. It sounds crazy in 2 years into this pandemic, or almost a year and a half into this pandemic. Where are the rapid tests, and why are Canadians turning to Twitter to find them?
Well, Joyce, I'm happy to have the opportunity to say that we've already transferred 86 million rapid tests to provinces and territories. And so I think Canadians should be looking to their provincial and territorial governments to ask where those tests are.
Yeah, but that's 2 tests per person.
And we have further tests. At this point, 43 million tests have been requested in December, which will arrive before the holidays. And we know that testing is part of the solution, but as other colleagues have already pointed out, there are extremely important gains that can be made by getting third booster. A third booster dose is available for all Canadians, and we also need to increase our numbers in terms of young people getting vaccinated. We now have a vaccine that is approved for children between 5 and 11 years old, and so I do also take this opportunity to speak to all parents that are listening, the importance of getting as many people
absolutely
as
that's
possible.
very important. But my question, absolutely, I have to agree with you that it is important for children to get vaccinated now that they can. But we are asking about these tests, and we're 18 months into this. I'd like to hear very quickly, because I really don't have time. Eric Duncan, do you think that these tests, yes or no, should be available in pharmacies so people can go buy them? Yes? No?
Absolutely, Joyce. That is a key part of the equation here as well. And again, you're right. The ArriveCAN app is an example that caught the government off guard, how they were woefully unprepared at the rollout of that. And rapid testing is the same way. You're right, 2 tests for every Canadian. We need to have more of an effort. And again, 18 months, the fact we're here in the program saying, where are the rapid tests? We don't know. There might be more coming. We're going to order them. This should have been a key of the equation months and months ago. And again, I just go back to the narrative here that it's constantly reacting from behind, scrambling to fix the ArriveCAN app, scrambling on rapid testing and so many options. It's very frustrating. And I think it only adds to the frustration of COVID, the pandemic going on and on. When they see these response and the lack of readiness to them, I think it just adds even more to the total as well.
Joyce, let me just specify, because you asked me about rapid testing, and the number I gave you is actually responding to the number that provinces and territories have been requesting. So the federal government procures. We have all of the rapid tests that have been asked for in this country.
Yes, but the federal government, I'm sorry to interrupt you, but the federal government doesn't need the provinces to tell them how many tests should be sent. Really, unfortunately, look, I think this is a really important conversation. I think it's time, for people to look at these rapid tests to see if they're useful, and I think they are, and perhaps the federal government and the provinces can decide whose fault it is. In the meantime, maybe you can order more, or they can be produced here or something. Unfortunately, that's all the time we have. Eric Duncan, Don Davis, Rachel Bindayan, thanks so much for sharing this time with us, and have yourselves a nice, safe weekend.
Thank you, Joyce.
Thank you, Joyce.
Thank you.